Welcome back, everyone. We're going to continue our discussion of GU emergencies by taking a look at chronic urologic diseases. The most prevalent chronic urologic disease that we're going to encounter within EMS is going to be chronic kidney disease. This is where inadequate kidney function is caused by a permanent loss of nephrons, and scarring occurs in the damaged nephrons to cease their function. Things like uremia and azotemia begin to develop, and there are systemic complications that can occur in patients with chronic kidney disease. These patients can often present with altered levels of consciousness, and other symptoms can vary but include lethargy and nausea, hypertension, and as well as pericarditis and pulmonary edema. Keeping in mind that the kidney is the primary filtering organism for the body, as well as the primary organ for regulating blood chemical substances such as electrolytes, potassium, sodium, calcium, as well as things like bicarbonate, we can see strong underlying metabolic complications arise in these patients as well. A patient with chronic kidney disease requires careful management, especially if they are in an acute state and contacting EMS. Chronic management of this disease isn't conducted within the field. These patients are often on dialysis, which we'll expand upon here shortly. But these patients, the thing that you should take away from these patients is they are at high risk for things like cardiac disease, pulmonary edema, and advanced level providers should be keenly aware that these patients are at an acute risk for dysrhythmias, in fact, lethal dysrhythmias that may need to be treated aggressively and through different methodologies than the traditional cardiac patient based on their underlying metabolic state. Make sure when you transport these patients that you transport them to an appropriate facility, and an appropriate facility would be a facility that possesses the capabilities of performing renal dialysis. So as part of your orientation process with your employer, you should become familiar, and those are some of the things that you should know. You should know where your trauma centers are, your cardiac centers, and then where your dialysis and hyperbaric chambers are as well, to make sure these patients get to the most appropriate facility for their needs. Renal dialysis is the method in which we filter a patient's blood, not we as an EMS, but we as in medicine, filter a patient's blood who are in a state of renal disease or renal failure. It filters the blood with toxic waste and removes excess fluid, and this helps restore those normal balances of electrolytes and fluid levels. The machine that you see on the screen is essentially an external kidney. It withdraws blood from the body and runs it through the filtering system and then deposits it back in the body. There are two types of dialysis. You have peritoneal dialysis and renal dialysis. With renal dialysis, patients have vascular access through something called a shunt. And this is where an artery and a vein are looped together, a graft is created, and it creates what's called a fistula. A fistula has a finite life in the patient, and you may have patients that have several fistulas if they've been on dialysis for an extended period of time. But that fistula is where we will access the patient's circulatory system to attach them to a dialysis machine. You'll most likely not encounter dialysis machines when you're transporting the patient. It's not uncommon to go to dialysis centers or transport patients to and from dialysis centers, but you're not likely going to have a dialysis machine that you're going to be transporting with you. Most dialysis machines are large machines that are housed in facilities or hospitals, but it's not uncommon, or it's becoming less uncommon for patients to have at-home dialysis machines. A dialysis patient will typically undergo dialysis every 2 or 3 days, and it's a process that lasts anywhere from 3 to 5 hours per session. You can see here is a larger dialysis machine seen at a dialysis center. Patients who miss dialysis treatment often present with signs of electrolyte abnormalities and imbalance, and this can include things like fluid overload or cardiac dysfunction, respiratory distress, and pulmonary edema. Other complications include things like muscle cramps, nausea, and vomiting, and then infections at the fistula or shunt site. It's also not uncommon for there to be excessive bleeding. When these patients are undergoing dialysis, they are typically on an anticoagulant medication or given an anticoagulant. And so fistula bleeding can be you can have a profuse amount of hemorrhage if they can't get the bleeding to stop. These will require extensive direct pressure for an extended period of time. And it's not uncommon if you have a fistula injury that you're going to be continuously trying to hold pressure and control bleeding on that for until you get to a definitive care location. It may be necessary that you apply a tourniquet if you can't control the hemorrhage through direct pressure, but we try to use direct pressure first to make sure we can control that hemorrhage. For untreated kidney injuries, we end up in states of volume overload, hyperkalemia for the advanced level providers, and metabolic acidosis and uremia. They're classified into three types based on where the kidney injury occurs. So you have perenal, intrarenal, and postrenal. And you can see a chart here that outlines some of the acute kidney injury presentation types. End-stage renal disease is the result of untreated acute or chronic kidney disease, and the kidneys have lost their complete ability to function. This state is fatal unless it's treated by dialysis or renal transplant. And this is oftentimes where we see patients undergoing dialysis when they are in end-stage renal disease awaiting kidney transplant.